This study is interesting because we really have long-term follow-up, and long-term, really longer than we would traditionally follow up some of these patients for a benign condition like chronic pancreatitis, after a surgical intervention. And I think a lot of times we expect that we provide the surgical treatment for these patients and we return them back to their normal lives. And in this study, we really have long-term follow-up examining, survival and cause of death in these patients well after that surgical period. And, what we see is that survival continues to decline well after that surgical period, even 5 years out from surgery. These patients are undergoing surgery at, just over 44 years old. And, 10-year survival is just over 60%. So there's a large portion of these patients that are dying within 10 years of this operation. And so that's really kind of the importance of this study and what we kind of saw when we were looking at this data. I think one of the other, important things that we highlighted with this study and identified is that there's a significant issue with some psychosocial issue with these patients after their recovery from surgery. We see issues related to substance abuse, narcotic abuse, suicide, end-stage liver disease. All these things come into play in these patients after this surgery and their recovery. The care of these patients is multidisciplinary. We need physicians and care providers from all different disciplines, not just surgery, caring for these patients, endocrinology, even psychology and addictive medicine. So one of the things that we kind of really saw as an opportunity is to potentially intervene on these patients that have ongoing substance abuse after they recover from the surgery. And can we intervene once they've recovered from the operation and prevent some of these sources of mortality in these patients? And I think that's exactly what we need to be looking at, because, as we kind of mentioned earlier, the early outcomes are quite good from the surgical intervention. And so determining that surgery is important, but then also getting them to the next phase of recovery is going to be as equally important.